Hello and welcome to Don't Tell Me to Relax, the fertility podcast here to guide you through the roller coaster of trying to conceive. I'm Hannah, your host, a fertility acupuncturist with clinics in London and across the UK. Our patients tell us how frustrated they feel about their lack of fertility education. So this podcast aims to provide all that education they never taught you in school, with the aim of putting you back in control of your fertility journey. We also have our fertility community to help address isolation and provide further information and support. To join us, the link is in the show notes. This podcast has been sponsored by FemHealth, a new online department store for fertility and conception. FemHealth help women embrace their fertility journey by providing access to products, treatment and resources. Fem is also home to Temp Drop, a new all-in-one device that you sleep in, giving you insights and valuable information on your cycle and fertility. Visit FemHealth at www.femhealth.co.uk with over 250 products and 60 brands to support your journey. Use the code RELAX15 for 15% exclusive discount. Hello, my lovely, and welcome to this week's episode of Don't Tell Me to Relax. I hope you are doing okay. Today, we are going to be talking all about the difficult situations that you can find yourself in when you're trying to conceive. So we're going to be talking about things like weddings, Christmas, baby showers, when a friend announces that they're pregnant, situations like that, that when you're trying for a baby can be really difficult. And we're going to talk about all the things that come with that, like why do we feel that way, what we can do about it. We're going to really validate how normal it is to feel pain and find those situations difficult. And who better to join me to talk about this than the lovely, lovely coach that we have in our team, Carly, who runs our monthly drop-in tea and chat, which is a support group for anybody who's trying to conceive that we run in our Facebook group. And Carly is also going to be running the part of Teaching to Conceive, which is all about helping empower you to understand your cycle and your fertility and get support on all the emotional difficulties that can come when you're trying. So Carly, would you like to introduce yourself and say a little bit about all the work that you do and how you came to work in this space?
Yes, hi. So I am Carly Garrett. I am a fertility coach, a miscarriage doula and a fertility reflexologist, and obviously your coach within the wonderful Hannah Pern team, which is amazing. And I qualified as a reflexologist almost 20 years ago, actually 20 years in February next year, and quickly went on to work with women trying to conceive. And that has just kind of really shaped the work that I've done ever since then. I quite quickly saw that there was a huge need for more emotional support around fertility. So that is what I've been adding to my training over that time, really, by constantly doing courses, which drives my husband mad. But constantly wanting to learn more and be better at what I do so that I can support my clients.
Yes, and I don't think I've ever known anybody have a longer set of skills and courses under their belt as you, Carly.
I know. I do. I love a course. I do love a course. So, yeah.
Well, that's really good because it just means you're well placed to talk to us today about this subject because you're obviously very experienced and you've got a lot of skills to help people who struggle in this situation. So can you tell us, have I mentioned in the introduction the main areas or the main events that trigger difficulty for people when they're trying to conceive? What is your experience of what those events are?
Yes, I think you did. I think, the pregnancy announcements are always huge. The questions that you get asked at weddings, Christmas, all of the family get-togethers where you're constantly being asked, are you going to have a baby? I suppose one of the big things that's coming up that I'm seeing a lot of at the moment is on Instagram, gender reveals.
Oh, yeah.
Also, I'm sure you're probably the same. I think obviously when you follow a lot of fertility accounts, which you and I do, and I'm sure most of our listeners do as well, you get the algorithm kind of matches you up. So I'm seeing lots of a friend announcing her pregnancy and then her best friend announcing it at the same time. And it's all really triggering, and it's huge. And I think, to me, what I see, I think when I work with clients and Christmas is coming up or they're going to a wedding, they can almost try and prepare themselves for the questions. And I do a lot of work with that with my clients. Let's get maybe even a little script together, or just a retort, or set some boundaries about how much you want to talk about things. But I think when you are just literally scrolling and you're constantly being bombarded and you're not really prepared for that, that's really triggering. And I think especially when, we know that a common time to hit Instagram and to go into that darkness of scrolling is during the 2-week wait, or when your bleed comes, or unsuccessful treatment. When you're dealing with that grief and that heartache, you can get yourself into that place and just constantly being bombarded with strangers. Really, it's not even people that you know, and that is really, really hard.
And why is it that it's so difficult? Can you sort of just unpick it a little bit? Because what specifically around pregnancy announcements, what often I hear from patients that I'm working with is that people feel guilty, that they feel nothing. Because when somebody announces it to you and you're not trying to conceive, you want to feel all the joy and all the excitement for that person. But I think people often they don't feel that. They feel those like ugly or more difficult feelings. And then on top of that, the guilt and shame that comes with that for having that automatic reaction. So can you just explain a little bit about that? Because I think it's really important to talk about it, because it's one of the most difficult things to sit with and unpick on your own.
Yeah. And the guilt, as you say, the guilt and shame can be huge. And so if we break it down, so you have this announcement via, however it is, if they're kind of, if it's a kind one, it might be a nice kind of little text to warn you. If it's not, it might be, you might be out for dinner, you might be scrolling, however which way. I know kind of during lockdown, the whole pregnant woman standing up during a Zoom meeting was quite, I just want to announce, that was quite big. So you get these mixture of feelings. And first of all, we can feel two feelings at the same time. So you can feel jealous and happy for them at the same time. It's so often it's not a case of that you don't want to feel happy for the other person. It's just that you feel sad, you feel heartbroken for yourself. So just to know that whatever you're feeling is absolutely fine and absolutely natural. As you said, what can then happen is that spiral. So you might feel jealous, you might feel angry, you might feel, these thoughts all start popping into your head, but they got married after us. All of these kind of scenarios that you'd played out in your head, or it might be your best friend and you'd always talked about being pregnant together. And it's just, you get bombarded with all of these thoughts, and then with the feelings and the emotions. So you might feel jealous, you might feel angry, you might just feel really, really, really sad because it's not happened for you yet, and it's what you want so much. And then what can happen, as you said, is you then feel guilty about feeling that way. And what I always say to my clients is, we feel the emotion of guilt when we need to make up for something that we've done wrong. So guilt is leading us to make up for something that we've done wrong. And I'd like you if you're in that situation, I'd like you to ask yourself, what have you done wrong? You haven't done anything wrong. None of those feelings are wrong, are incorrect. You will have grief, you'll have heartache, you'd have sadness, you'd have so many feelings, so much anger going on inside your body. Let's not add to that, because then when you start feeling guilty, then you start feeling the shame of feeling guilty. So if you can start catching that before it happens and sitting with those feelings and just saying, it's okay for me to feel like this. Of course I will feel like this. I think that can kind of soften them. And then questioning that you start feeling guilty, questioning yourself around that. Is that is that correct? Is that the correct emotion to be feeling?
Yes, because I think adding that on top of an already difficult situation makes it even harder. And I think it's interesting, isn't it? Because I think as a society, we don't practice sitting in pain very often.
No.
Like we don't sort of talk about it as much as we should do, given that we all experience it. We all experience jealousy, fear, anger, but we don't like to talk about those feelings too much in sort of general society. We kind of like brush over them, and therefore they kind of become a bit sort of forbidden and more uncomfortable. And yet we really need to sit with those feelings and not judge those feelings, because when we start judging them, you're in a whole sort of spiral of difficulty. And I just think, practicing compassion towards yourself is really important in such a difficult time, and acknowledging that it's really difficult, really shit and really unfair.
Yeah, absolutely. And if you can try and think about it as if you were speaking to a friend.
Yeah, that's a good one.
We're so mean to ourselves. We're so mean, and we are kind of conditioned in that way to be hard on ourselves, aren't we? And so, like you say, it can set off the spiral. So what can happen is you then start feeling guilty, and then all of a sudden you're this awful person that doesn't even deserve a baby anyway. And it's just that spiral that keeps happening, and then that triggers another thought, and then that triggers another emotion. And by the end of it, you can be completely floored by it. So if we can try and stop it, and actually on my I have put together a kind of like a little mini series, like a mini class about harnessing your thoughts, feelings and emotions, and about trying to stop that. So that's a free recording on my website if anybody wanted to have a listen to that, and just about noticing them. And again, as you said, they're all classed as bad emotions. These bad, nasty, kind of dirty emotions that we shouldn't speak about, and we really should. We really should. And hopefully, the listeners have got people that they can speak to about this, about how they're really feeling, as opposed to putting on this mask and just being okay.
And so when people are in this situation, what are the sort of practical things that people can do? So let's take, for example, if you are going to an event, so if it's a wedding, let's say, and you're feeling anxious about it, what are the things that you say to your clients? How do you help them to prepare for the difficulties that might come in that situation?
Yeah, so much of it is about the preparation. So I use EFT with my clients, so we can do a tapping sequence to get them into, I can do this, or even just affirmations. I can get through this. I can do today, if you're completely dreading it. I think it's really helpful to have something in your mind that you can use as a retort, just a quick one-liner that is well-versed, whether it's a case of, we are trying and it's not happened, or you might not want to share that, whether, our time might come, just something that you've got in your mind that will help you.
And in terms of pregnancy announcements, do you think, it's so individual, isn't it? But if you're in that situation, so like, for example, we see so many people who are in their early 30s and they're literally surrounded, or late 30s, mid 30s, surrounded by everybody getting pregnant, whether it's in the workplace, whether it's their friendship group, their siblings. So do you think it's better to preempt friends and family and say, look, I'm struggling to conceive. If you find out you're pregnant, will you let me know by text? Or, how do you think people should approach it? Or do you just think you just have to kind of take it in a case by case basis and see what happens?
I think it's a case by case basis. From what I've seen with working with my clients, everybody's so different. Some women want to be open and want to be able to speak about it, and others, I work with clients and have done over all the years that have not told anybody. It's their husband, them and me that know. And that is when it's really, really hard, because they don't have any other outlet. And so I think if you can, I think that is definitely the best place to do it, because I've had clients that have been out at dinners and somebody stood up and revealed, and that really crap. That's really shit.
Yeah.
That is kind of, and in that scenario, you might need to just stand up and walk away. You've got to do what you have to do to protect your heart. And that doesn't mean you don't love the person. It doesn't mean that you're not happy for them, but sometimes that can just be too much. And then I have other clients that dread these situations that they're going, they retreat from seeing their friends because they are terrified that this is going to happen. So if you can open up, and so that you know that it isn't going to be announced at a dinner or so forth, or an event, then you can keep seeing your friends, because otherwise what I see is that you can really, really retreat from your friends from the fear of that happening.
Mm. And what do you think about this idea? Because I see lots of people who often just don't go, and
Yeah.
they say, and some people don't go because they can't face it, and some people don't go because they have just kind of like withdrawn and they don't want to put themselves in that situation. So do you think that is a good mechanism? Because people often don't go and then they feel terribly guilty
Yes.
about not going, and
Mhm.
and really struggle with this. I've had lots of times when somebody's got an event coming up and we've talked about it, in the run up to the event. Are they going to go? Are they not going to go? And all the feelings that come with that, like, it's so difficult, isn't it, to know what the right thing is to do?
It's so difficult, and also that's just so impactful on your life, isn't it? It's that, if you've got something that in theory you should be quite looking forward to going to, but in the month before you're going through this, am I not going? The anxiety that brings, the feelings in your body, the change of mood, how you're coping. It really also can depend on where you are in your cycle, as we've spoken about before. It's you're generally much more up for things and able to kind of tolerate it and handle it in your follicular phase. So I think, again, it's just up to the individual. But if you make that choice, be kind to yourself. You've made that choice for a reason. And I think this is where it is easier if you can speak to your friends about it, because then you can let them know. And then hopefully we can never gauge what somebody else's response is going to be, but hopefully they will be understanding.
Yeah. And I think, like, exactly like you said, I think it's really important to know that it's a really difficult situation.
Mm-hmm. Yeah,
it's such
really,
a difficult
really, really
situation,
difficult.
And you're kind of in that situation where you're damned if you do, you're damned if you don't.
Completely.
And that's nothing. You have not caused that. That is not your fault. It's not because you're lacking in some way as a human being. It's because you are a human being, and in that situation, it's difficult. And I think it's important to acknowledge that, isn't it? Because people really struggle, and I put myself in this as well. When you have to say no to somebody and you have to miss out on something, the sort of guilt you feel about that can be overwhelming, sometimes more so than turning up and feeling really sad that you're there, and it's really horrible for you.
Yeah,
so
that's true. Yeah.
You can't, in a lot of cases, it's very difficult to win. I guess sometimes it's about what is less worse. I'm not sure that's English, but what is the thing that you can sit with?
Yeah, absolutely. And you have, it might help if you get it down on paper, run through, how you can deal with it. But you're right. I think it's that whole fact of feeling like you're letting people down, isn't it? And, if it's a birthday party, or if it's I suppose a wedding is much harder just to kind of pull out of. And so sometimes it's a case you've got to do it. And interesting enough, I had a session last year with a client who it was that she went to a family dinner, and they did a gender reveal at the family dinner, and it came out of nowhere. And she felt that actually it was better that she didn't know that was going to happen, because if she did know, then she would have really, really worked herself up. And actually she dealt with it much better than she thought she would. So it's really so sometimes it's just about timing, it's how you're feeling. And if we can buoy you up, if we can get you in a stronger place, if you can have tools and techniques to keep you out of that fight or flight state and make your body feel safe, then hopefully it's not as much of a kind of a gut punch to you.
And I think that the baby showers, the baby shower thing is the hardest. That's what I hear from a lot of my patients, because it's sort of like, it's like showing a mirror, isn't it, to all the things, the place that you wish you were and the things that you haven't got.
Absolutely.
And I think, if you feel that you can't go to your sister-in-law's baby shower, then don't go to your sister-in-law's baby shower. It's okay, because it's a really, baby showers didn't used to be a thing to start with.
And they're huge right now, aren't they?
Yeah, they really are.
And it is, you're completely right, because it's a case of, and especially with, if we think about the clients that we work with, the month on year trying to conceive, the ladies that have experienced loss along the way, and trying to conceive after that. And you're completely right. When you go to these things, when you have your life planned out in your mind, don't you? You're kind of forward thinking, and that's also why kind of Christmas is hard. The whole we didn't even talk about the whole photos on doorsteps when children are starting school. That's another big trigger. And in your mind, and and if you do get a positive pregnancy test, have a positive pregnancy test, and you have a loss, you've got that due date in your mind. That doesn't go. Year on year, that still stays there. How old they would be, and also that goes for women that haven't experienced loss. Women that are trying month after month, year after year. That you still have these dates in your mind, and so when you go to these things, you're completely right. It is like looking at it. That is a life that you want desperately. That's a life that you wish and you pray for. And you're seeing someone else play out your part in that life, and that's really, really difficult.
So what other bits of information or advice can we give to people to kind of help support them if any of this is kind of ringing and they're thinking, yeah, that's how I feel, or I've got this coming up, or I guess we're coming up to Christmas, and I'm sure there's always a baby shower around the corner. What other tools or techniques can we point people towards to sort of help them through that?
Yeah, I think so. As I said, so much of it is in the preparation around, or just general day-to-day life. So, firstly, I'm a big fan of kind of advising my clients to almost, if they find themselves that they scroll a lot, they're on Instagram a lot, it's really hard just to say stop that. So sometimes I kind of suggest that maybe they want to set up another account that is kind of like a nice, soft, lovely account, that if they do feel like they need to scroll, they can do that, and they're not going to get any triggers. So just things like, I like watching people draw, or dance, or something that you can just kind of immerse yourself in, to lose yourself for a bit of time, but you're not going to get those triggers. I've got, on my website, I've got 3 free pieces of content. So one's a guided meditation, one is about your harnessing your thoughts, feelings and emotions, and another is 10 simple ways to ease the weight. And in there are lots of resources in there, so they're all easy to be kind of downloaded for free. Come along to my tea and chat, which is on the last Wednesday of every month within your group, and just try to get yourself a toolkit. So try to, on a daily basis, does it help you to journal? Does it help you to listen to a guided meditation. Some people hate them, some people love them. Does it help you to practice yoga daily? Just bring in things just to buoy you up, bring in moments of joy. What floats your boat, what do you really enjoy doing? And just so if we can buoy you up that side, then that's going to help you when you go into the triggering moments.
Yes, that's brilliant. Thank you, Carly. And the other things that I'm going to add as well is sometimes I think seeking like either counselling or psychotherapy, going sort of down that talking therapy route can also be helpful, because sometimes a lot of the feelings and the thoughts that you might have are obviously around the trying to conceive, but they might also relate to stuff or experiences that's happened in your upbringing that really kind of bring this out. And I think sometimes unpicking that with a professional can really help you understand why situations might be triggering you more than you would expect them to be triggering, and that might be related to something else. So again, having the awareness, and we'll put all the information that Carly's mentioned and that we've discussed, we'll put it all at the end, because there are counselling services that are specialists in fertility, or general counselling can be good, or psychotherapy. And we've got an episode with Alejandra from Fertility Support where she talked about the difference between coaching, counselling and psychotherapy. So that's also there.
Yeah.
Carly, anything else that you'd like to add before we finish up?
I think just to kind of emphasise, be kind to yourself.
Yes.
Protect your heart. We never know how somebody is going to respond to something. We never know how somebody, we put up our own boundaries. Other people generally don't like boundaries because it means that they can't kind of take advantage of us and so forth. So just be compassionate to yourself. Be aware of that voice in your head. If you're not being nice and kind to yourself, like you said, question why. Where does that come from? Because as you say, it's come from the past. And by putting the work that I do with my clients, I kind of, this is a lot of the time, it's kind of, I will say to them, let's put the baby aside. Let's not think, let's focus on you. This isn't about, yes, obviously I completely want them to have a baby, but my focus is on my clients and getting them through this and giving them tools and techniques that they're then going to carry on helping them and benefiting them throughout the rest of their life. And it's so easy. I guess it's the same with you. When we have clients that come to us that are experiencing really heavy periods or painful periods or so forth, I'm of much of a view of, I'm not even focusing on the baby right now. You should not be living your life like that. And I guess that's what I'm trying to say. It's a case of let's focus on you and what your needs are, and protect your heart, and try and speak to yourself as if you would be speaking to your best friend.
Yes.
And send yourself the love and kindness that you would do them.
Yes, that's really it's a really good way of thinking about it. I think it's helpful, isn't it, to think about how you speak to other people, because I'm sure we all do it. We would never speak to our friends the way that we have that internal dialogue with ourselves. No. So why we do it to ourselves is something to really think about and seek help on, I think.
Yeah,
if it becomes overwhelming.
Absolutely. Yeah, absolutely.
So I'm just going to say again before we pop off, to say that if you'd like more support, then obviously we're running the Teaching to Conceive, the TTC course, which has got lots of information from a very practical point of view on menstrual cycles and tracking your cycle, to more of the emotional support from Carly as well. So all the details to join are on there. And if it's past and you're listening to this in the future, then it is available to catch up if you'd like to catch up on it. And obviously it's completely free. And we've got our Facebook community, because community really does help. Being in a group of people who get it, who are going through, obviously not the same because we're all different, but who are in a similar situation, who are facing the pregnancy announcements, who are not wanting to go to the wedding. It's a great community where you can put up questions and just say, I'm having a shit day. Is anyone else? And just knowing that you're not alone, for some people can be helpful. And obviously Carly runs the tea and chat every month. So lots and lots of stuff in there. And obviously it's also free. So Carly, thank you so much for your time. It's lovely as always to talk to you.
Thank you very much for having me.
We hope you have found this episode helpful. If you'd like to leave us a review, we would love you to bits. And if you'd like more support for your fertility, you can come and work with us in clinic. We're based in London and around the UK, or you can work with us online. For more information, see the link at the end of the show.